Chairman, having to be hospitalized is physiologically and emotionally stressful in many ways. Fortunately, our health workers work hard to minimize the inconveniences of the experience as much as possible. Even so, to know that you have to wait long hours for a bed in Singapore does not correspond with what many older Singaporeans in particular expect of our healthcare system. At their moment of need, many of our seniors and even citizens across various age groups did not believe that they would have to wait hours in a chair in an A&E department or be decamped to beds located at a temporary car park where the lights are never turned off at their moment of critical need. The Ministry of Health currently publishes the daily median waiting time at emergency departments on a delayed basis of 2 weeks. In some hospitals, even at the median, the waiting time for a bed can exceed 16 hours. This was the situation at the end of January at 𝐒𝐻 and Changi General Hospital. Imagine being ill and uncomfortable and having to wait 16 hours for a bed. This hospital experience is being narrated anecdotally to me by an increasing number of seniors. In order to have a more accurate perspective of the problem, would the ministry be prepared to publish the waiting time for an admission to a ward, not just at the median, which it does now, but at the 75th and 90th percentiles as well, for a more holistic overview of the situation on the ground? Secondly, in view of the situation today and in the short term, can the ministry generate a publicly accessible or build within mobile health applications such as Health Hub a resource that provides information on waiting times at A&E departments in our public hospitals and details on bed occupancy in as close to real time as possible, perhaps even on a 2-hourly basis, so that patients and their caregivers can exercise the option of going to an A&E department that is less crowded? This would also relieve and better spread the patient load at hospitals where doctors and nurses, allied health workers and staff consistently see higher A&E admissions and bed utilization. Sir, the reality of our growing senior population has been on the radar for decades. I understand moves are underway to increase the number of hospitals and polyclinics. In fact, piling works have just begun last month for the Eastern Integrated Health Campus in my ward of 𝐿𝐮𝐩𝐻𝐿 GRC, the development of which is expected to take some patient load off Changi General Hospital. These developments should improve the situation, but it has to account for the rising number of seniors and Singaporeans who inevitably will have to tap onto the healthcare system in some shape or form, and also to account for the rising healthcare manpower needs. Thirdly, there have been reports of patients preferring to stay in a hospital longer than they are supposed to, despite being medically fit for discharge. One report cited an expert as postulating, for example, that 3 out of 10 NUH patients or their family members have to contend with discharge issues. While each situation would have to be looked at on a case-by-case basis, such patients can exacerbate the problems faced by the primary healthcare system. How many patients were labelled as overstayers in our public hospitals in 2023, and how serious is this problem? The ministry has announced plans to increase beds over the next 5 years, and the number is 1,900. Can the ministry share its plans on how it intends to expand home care services over the next 5 years as well, to reduce patient load in hospitals, and so as to ensure that the load on our healthcare workers is not more than it needs to be?